An orthopantomogram, OPG, was requested following trauma. Trauma. No fractures are visible on the film, but there is loss of the lamina dura and a well-defined expansal lyric lesion affecting the ramus of the mandible. This lesion has a narrow zone of transition and no associated soft tissue mass. The bones are diffusely osteopenic. What is the most appropriate investigation? A CT scan B biopsy of the mass CESR DPTH level E calcium level 2 a 5-month-old baby girl was being investigated for blindness. One answer D, PTH level. This patient has hyperparathyroidism, and the lyric mass is a brown tumor. Generalized loss of the lamina dura is seen in osteoporosis, osteomalacia, Paget's disease, scleroderma, and hyperparathyroidism. The description is typical for a brown tumor, and these are most commonly seen in primary hyperparathyroidism. The jaw is the most common site for these tumors. 2 Answer A, coloboma. A coloboma is a congenital defect in the orbit, which is caused by incomplete closure of the choroidal fissure. They are typically cone or not Notch-shaped and commonly affect the inframedial portion of the globe. They are bilateral in 50% and can occur in association with other congenital abnormalities. Such as encephalocele, agenesis of the corpus callosum, or as part of a syndrome, charge syndrome. 3. Answer C. Pineoblastoma. Leukocoria is a white papillary light reflex. This can be caused by tumors. Blindness. On CT, both her globes were elongated with a cone-shaped deformity affecting the posterior globe, which involved the optic nerve. The defect passed inferiorly and communicated with vitreous. The girl had cardiac abnormalities and choanal atresia. What is the eye abnormality? A coloboma B congenital glaucoma, C. rubella retinitis D trauma, E. orbital hematoma. 3. A 6-month-old child has bilateral leukocoria. On CT, there were bilateral solid smooth lobulated hyperdense lesions with nodular calcification within both orbits. The tumors were in the posterolateral region and were indistinguishable from the wall of the globe. The globes were both of normal size. What other abnormality should be looked for on CT? A cortical tubers B. subependymal heterotopia. C. Pineoblastoma D. persistent hyperplastic primary vitreous E. Coates disease. 4. ACT, head on a 60-year-old male demonstrated bilateral small tumors, retinoblastomas, retinal hamartomas, developmental, PHPV, Coates disease, infections and trauma. These bilateral orbital masses are retinoblastomas, and this is a very typical description. The peak age is 18 months and males and females are affected equally. 2/3 are sporadic and of these only 30% are bilateral while in the hereditary form 70% are bilateral. When bilateral retinoblastomas are associated with pineoblastomas, they are called trilateral retinoblastomas. 4. Answer B. Drusen. Calcific densities overlying the junction of the retina and optic nerve. The intraconal portion of the optic nerve appeared normal. No other abnormalities were seen on CT. What is the most likely diagnosis? A retinoblastoma B. Drusen C. Coates disease. Drusen. Drusen are the accumulation of calcified hyaline material typically in the region of the optic nerve. It is bilateral 75% of the time and is often familial. Typically, on CT, they are flat discs of calcification overlying the optic nerves. Patients present with headaches and visual field defects. 5. Answer B. Microphthalmia. Persistent hyperplastic primary vitreous, PHPV, is a rare condition caused by persistent choroidal osteoma. 5. A newborn child is noted to have leukocoria. A CT was performed. What feature makes persistent hyperplastic primary vitreous more likely than retinoblastoma? A. A calcified intraorbital mass. B. Microphthalmia. C. A diffuse infiltrating mass. D. Moderately high signal on TI. E. Bony destruction. 6. A 45-year persistence of the primary vitreous, which presents in newborns with leukocoria. The orbit is small and deformed with a flattened lens, and the optic nerve is small. PHPV is hypervascular and prone to bleeding, hence the vitreous is dense due to repeated hemorrhage. No calcification is demonstrated. Retinoblastomas cause expansion of the globe, are calcified, and cause bony destruction. Both tumors can be high signal on T1 weighted imaging. 6. Answer E. Kinking and bucking of the "45-year-old male complained of worsening vision. On cross-sectional imaging, the left optic nerve appeared thickened. What feature makes optic glioma more likely than optic nerve sheath meningioma? A unilateral mass. B. hyperestosis affecting the optic canal. C. diffuse homogeneous enhancement decalcification. E. kinking and buckling of the optic nerve. 7. The optic nerve. 7. Answer A. High signal on both TI and T2 weighted imaging. Orbital melanomas are high signal on both TI and T2 weighted imaging. They are the commonest intraocular primary in adults, arise from the choroid's plexus, and are associated with retinal 55-year-old gentleman was investigated for sudden onset visual loss affecting the right temporal region. Ultrasound of the globe demonstrated right-sided retinal detachment, with an associated well-defined flat echogenic mass was seen. An uveal melanoma was suspected and an MRI scan performed. What are the likely signal characteristics of the lesion? A high signal on both TI and T2, weighted imaging B high signal on T1, weighted imaging and intermediate on T2 C high signal on T1, weighted imaging and intermediate on T2 D high signal on T1, weighted imaging and detachment, vitreous hemorrhage and glaucoma. 8. Answer B, precocious puberty. E low signal on both TI and T2, weighted imaging 8. A 7-year-old was referred from the maxillofacial surgeons for assessment of facial asymmetry. X-rays revealed expansion of the right maxilla and frontal bone with a featureless ground glass appearance. He was also known to have multiple cafe and laic spots. What other feature occurs commonly with this condition? A osteosarcoma, B precocious puberty, C and plaque meningioma, D dentigerous cysts, E brown tumors, 9. A 17-year old male patient with recurrent left-sided epistaxis. Puberty. The imaging features are typical of fibrous dysplasia. Fibrous dysplasia, multiple cafe and laic spots, and endocrine disorder such as precocious puberty and hyperthyroidism are seen in McCune-Albright syndrome. Epistaxis and associated mucopurulent discharge was investigated urgently in and outpatients. He underwent a CT scan which revealed a unilateral, low attenuation mass filling the left maxillary sinus with extension into an expanded nasal cavity and middle meatus. A subsequent MRI also showed the mass, which appeared bright on T2, weighted images, and displayed peripheral enhancement following for gadolinium. What is the most likely diagnosis? A juvenile angiofibroma B mucocele of the maxillary sinus, C nasopharyngeal carcinoma, D anthracoanal polyp, E inverted papilloma. 10. A 5-year-old boy presented with hearing loss. 9. Answer D. Anthracoanal polyp. An anthracoanal polyp is a benign expansal lesion of the maxillary sinus, which usually arises from the maxillary antrum and causes bone remodeling due to mass effect. On CT, the mass is of homogeneous low density, reflecting the edema 2 nature of the polyp. They fill the antrum, expanding through the secondary ostium into the ipsilateral nasal cavity, and may even extend through the posterior choana into the nasopharynx. The edema 2 mass displays low signal intensity on TI weighting and high signal on T2. There may also be peripheral enhancement post-gadolinium. By definition, an anthracoanal polyp extends into the nasal cavity, and the diagnosis is aided by the evidence of bony remodeling rather than erosion, the latter being suggestive of a malignant process. A mucocele can be expansal but would not extend beyond the cavity of the sinus. An inverted papilloma displays moderate enhancement on CT and intermediate signal intensity on T1W images with definite enhancement post-contrast. 10. Answer E. Congenital. Congenital cholesteatoma. Loss. An intact, dry tympanic membrane was visualized and audiology confirmed a conductive hearing loss. A CT was performed which revealed a lesion medial to and eroding the ossicular chain, which fills the oval window niche, and does not enhance following contrast. An MRI confirmed the lesion was low intensity on TI and high signal intensity on T2, weighted images. What is the most likely diagnosis? A acquired cholesteatoma B glomus tympanicum C cholesterol granuloma, E high jugular bulby congenital cholesteatoma 11A15, year. Cholesteatoma. Cholesteatomas can be classed as either congenital or acquired. They appear as relatively well circumscribed masses, which sometimes contain cystic areas and do not enhance post-contrast. A congenital cholesteatoma typically occurs in childhood as a result of inclusion of squamous epithelium within the temporal bone during development. An intact trademark is visible on both examination and on radiological images, and the patient is often asymptomatic. An acquired cholesteatoma arises from a retraction pocket of the tympanic membrane, usually causing a chronically discharging ear and grossly abnormal tympanic membrane. Membrane. In 70 to 80% of cases of acquired cholesteatoma, the mass is seen lateral to the acicular chain. Conversely, in the congenital form it is medial and fills the oval window niche. Cholesterol granulomas are granulomatous lesions, which are thought to arise as a result of an inflammatory process, and contain both cholesterol and hemosiderin deposits. The appearances on CT are very similar to those of cholesteatomas, and may even be indistinguishable. On MRI, however, cholesterol granulomas can be differentiated from congenital cholesteatomas. Cholesterol granulomas display high signal intensity on both TI and T2 weighted images as a result of the presence of hemoglobin breakdown products. Cholesteatomas are of low signal intensity on TI and high intensity on T2W images. Glomus tympanicum are a type of paraganglioma arising from the paraganglion cells around Jacobson's nerve in the middle ear. They are the most common primary neoplasms of the middle ear, and on examination can be seen as a pulsating cherry red mass behind the tympanic membrane. On CT, the mass can be seen arising from the wall of the middle ear, and as a result of its hypervascular nature displays intense enhancement post-contrast on both MRI and CT. 11. Answer A. Year-old girl complained of a 6-month history. History of left-sided unilateral tinnitus. A pulsatile mass was visible in the ipsilateral middle ear. A high-resolution CT scan of the temporal bone showed an absent foramen spinatium with the internal carotid artery following an aberrant course laterally in the middle ear on this side. A carotid angiogram revealed a vascular structure arising from the aberrant carotid artery terminating in the middle meningeal artery. What is the most likely diagnosis? A persistent state dial artery A. Persistent state dial artery. A persistent state dial artery, PSA, is a vascular anomaly that arises from the Purton's part of the internal carotid artery. It can present with hearing loss, pulsatile tinnitus, or a mass seen over the promontory in the middle ear on otoscopic examination, but is often an incidental finding. The prevalence is approximately 0.05%. The state dial artery develops from the hyoid artery during early fetal life and divides into upper and lower branches. The upper branch becomes the middle meningeal artery, and the lower leaves the cranial cavity via the foramen spinatum and becomes the inferior alveolar and infraorbital arteries. If the state dial artery persists, then the middle meningeal artery arises from it and the foramen spinatum is aplastic, hence absence of the foramen spinatum is an indirect sign of PSA. A small vessel arising from the petrous part of the internal carotid artery and coursing through the middle ear cavity may be visible on CT, and if not recognized, injury can cause hemorrhage during middle ear surgery. PSA can also be associated with an aberrant internal carotid artery. Jane R. ETAL persistent Eglomus tympanicum 12, a 65-year-old man attended the ENT outpatients complaining of a 1-year history of unilateral tinnitus and vertigo. Audiology confirmed a unilateral sensorineural hearing loss on the affected side. An MRI scan demonstrated a mass that was thought to be an acoustic neuroma. What signal characteristics are most likely? A hyperintense on T1, weighted images, B enhancement following gadolinium, C no enhancement following gadolinium, D hypointense on T2, weighted images. E isointense to gray matter on T2, weighted. Persistent state dial artery. Radiology. 2004, 230, 413 to 16. 12 answer B, enhancement following gadolinium. Acoustic neuromas are also known as vestibular schwannomas, and are the most common tumors of the cerebellopontine angle. They arise from the perineural Schwann cells of the vestibular division of the 8th cranial nerve, and are usually unilateral. In type 2 neurofibromatosis they are, by definition, bilateral. A vestibular schwannoma displays the characteristic imaging appearances that are common to all schwannomas. On CT imaging they are isointense with brain parenchyma, exhibiting enhancement post-contrast and containing cystic components. On MRI the lesion is isointense with brain parenchyma on T1W images, hyperintense on T2, and displays enhancement post-gadolinium. 13 answer B, high signal intensity on T2, weighted images. Images. A torn-walled cyst is a benign submucosal lesion found in the midline of the posterior nasopharynx. Isointense to gray matter on T2, weighted images 13. A patient with postnasal drip and a persistent foul taste in the back of the mouth was diagnosed as having a torn-walled cyst. What was the likely appearance on imaging? A low signal intensity on T1, weighted images B high signal intensity on T2, weighted images C low signal intensity on postgadolinium T1, weighted images D low signal intensity on T2, weighted images E very low attenuation on CT14. A patient Nasopharynx. It is a diverticular remnant lined by squamous epithelium and occurs due to a persistent communication between the notochord and the nasopharyngeal epithelium during development. As a result, it can become filled with proteinaceous secretions, then intermittently discharge its contents into the nasopharynx. A midline mass is seen on CT along the posterior wall of the nasopharynx that exhibits high attenuation due to its increased protein content. This high protein content is also reflected in the MRI findings of a thin-walled, cystic structure seen within the pharyngeal bursa between the longus colli muscles that displays a high signal intensity on T1W and T2W. Characteristically, the cyst does not enhance with contrast. 14 Answer B. Frontal sinus mucocele. Presence to the ophthalmologist with proptoses and bossing of the forehead. A CT scan shows complete opacification of the frontal sinus with bony expansion and remodeling. On MRI, there is opacification of the frontal sinus with peripheral rim enhancement. What is the most likely diagnosis? A mucus retention cyst B frontal sinus mucocele, C inverted papilloma, D sinusitis, E frontal sinus squamous cell carcinoma 15. Colli muscles that displays a high signal intensity on T1W and T2W. Characteristically, the cyst does not enhance with contrast. 14 Answer B. Frontal sinus mucocele. A sinus mucocele is an expansal lesion, which develops as a result of obstruction of the sinus ostium, containing mucoid secretions, and lined by respiratory epithelium. Mucoceles can arise from any of the sinuses, but most commonly affect the frontal sinus, 65% of cases, with the sphenoid being the least affected. On CT scan there is complete opacification of the sinus, as it is filled with mucoid secretions causing the sinus cavity to enlarge, and the walls to undergo remodeling and thinning due to pressure necrosis. The diagnosis is confirmed if there is complete absence of any remaining air within the sinus. These appearances are in contrast to mucus retention cysts, which occur because of blockage and swelling of a mucus gland within the sinus mucosa, and therefore air remains within the sinus cavity itself. Characteristic appearances on CT are that of an expanded frontal sinus cavity, filled with homogeneous low attenuation matter. The peripheral rim enhancement enables it to be differentiated from other pathologies such as inverted papilloma. Due to the high water content, 95% of the secretions the signal intensity on MR is of low intensity on TI and high on T2W images. A malignant pathological process would be expected to cause bone destruction as opposed to remodeling. A frontal mucocele can extend into the upper orbit causing the patient to experience a range of symptoms such as proptoses, nasal obstruction and bossing of the forehead. 15. An elderly diabetic patient presented to his GP with severe right ear pain out of keeping with the visible findings of an erythematous external auditory canal with some granulation tissue. A CT scan was performed and an abnormal soft tissue mass was visualized in the internal auditory canal. He was subsequently diagnosed with malignant otitis externa. Which of the following is the most appropriate? A. On MRI the granulation tissue would be expected to be low intensity on both TI and T2. Weighted images BCT is the imaging modality of choice to assess skull base involvement. C. The radiological appearances are usually contemporaneous with the clinical findings. D. SPECT is ineffective in monitoring for 15 Answer A. On MRI the granulation tissue would be expected to be low intensity on both TI and T2 weighted images. Malignant otitis externa is a potentially fatal infection of the external ear, which presents with severe, deep otalgia, and tends to affect immunocompromised individuals, particularly those with diabetes. It is almost always associated with pseudomonas aeruginosa. A high index of suspicion is required and, if left undiagnosed, the infection can result in osteomyelitis of the skull base causing erosion of the mastoid and temporal bones. This can result in lower cranial nerve palsies, sigmoid sinus thrombosis as well as meningeal and intracranial involvement. On CT, an abnormal soft tissue mass is visualized in the external auditory canal with associated bony destruction and opacification of the mastoid air cells. On MRI, the granulation tissue is classically low intensity on both TI and T2 weighted images. MRI is generally superior to CT with regard to detection of skull base involvement due to its ability to identify bone marrow edema. The radiological appearances usually lag behind the clinical and pathological findings. 16. Externa on CT16, A65, year, old smoker presence with hoarseness, and investigations demonstrate a laryngeal carcinoma. A lymph node metastasis is identified in a cervical node lying anteriorly to sternocleidomastoid and above the hyoid bone. What anatomical classification is appropriate? A level IB, level 2C, level 3D, level 4E, level V17, A48, year, old man presence with a hard mass in the parotid gland. CT and MRI were performed, and as a result of the radiological appearances, a differential of mucoepidermoid carcinoma, and answer B, level 2. See table below of the anatomical boundaries of the 6 cervical lymph node levels. Harrison L., Sessions RB, Wan Ki Hong. Head and neck cancer, a multidisciplinary and adenoid cystic carcinoma was postulated. What characteristic radiological feature do they both exhibit? A ground glass appearance on CT. B. Hyper. Baltimore, MD, Lippincott, Williams and Wilkins, 2008. p. 183. 17. Answer E. Carineural extension. The most common malignant tumor of the parotid gland is mucoepidermoid carcinoma, and in children it is the most frequently occurring salivary gland malignancy. This tumor type is composed of both mucoid and squamous epidermoid cells, the latter forming the majority of the cell population in the more high-grade tumors. On both CT and MRI, the imaging appearances can vary depending on the grade of the tumor, with low-grade lesions appearing well circumscribed, while higher-grade lesions are poorly defined and infiltrative. Signal intensities on both TI and T2 weighted images are low to intermediate, and enhancement is clearly evident post-contrast. A hypointense signal intensity on T2W images enables differentiation between a parotid malignancy and a pleomorphic adenoma. Both adenocystic and mucoepidermoid tumors can exhibit perineural extension. Hyperintense signal on both Ti and T2, weighted. Perineural extension 18A20, year, old man presented via the emergency department following a suspected punch directed low on the maxillary alveolar rim in a downward direction. Examination findings included facial edema and mobility of the hard palate. Facial view X-rays revealed a fracture line extending from the nasal septum to the lateral piriform rims, running horizontally above the teeth apices, crossing below the zygomaticomaxillary junction and traversing the pterygomaxillary junction to interrupt the pterygoid plates. What is the most likely diagnosis? A. LE Fort IB LE Fort 2C LE Fort 3D orbital blowout fracture. E. 18 Answer A. LE Fort I. All LE Fort fractures involve the pterygoid process. LE Fort I is a transverse fracture through the maxilla. LE Fort 2 is more extensive and the separated fragment is pyramidal, while in LE Fort 3 there is complete craniofacial disjunction. In practice, fractures do not fit these descriptions exactly and may be asymmetrical or coexist. The classification is still in general use and aids in subsequent surgical management. In LE Fort I and 2 the fractured maxillary fragment is usually wired to the zygomatic arches, but if these are fractured as in LE Fort 3, a more complex pin and rod fixation to the skull vault is undertaken. Tripod fracture 19 A 6-month-old child was admitted with lethargy, fever and dysphagia. A lateral neck plane film demonstrated thickening of the retropharyngeal soft tissue with smooth bowing of the anterior border. On CT, there was extensive prevertebral soft tissue swelling with fat streaking, and a 2 cm peripherally enhancing low-density mass medial to the carotid artery. What is the most likely pathogen? A Haemophilus influenza B Staphylococcus aureus C pseudomonas aeruginosa D Escherichia coli E herpes simplex virus 20. Answer B. Staphylococcus aureus. The most common pathogens that result in a retropharyngeal abscess are Staphylococcus aureus, or group A beta hemolytic streptococcus. The retropharyngeal space is an important potential space posterior to the pharyngeal mucosa extending from the skull base to the T4, and is important as it is the route through which infection can spread to the mediastinum. Retropharyngeal abscesses typically follow an upper respiratory tract infection and present in children with general malaise, anorexia, and stridor. On lateral neck plane X-rays, there is thickening of the retropharyngeal space, and blebs of air may be seen in the abscess. A false positive result may occur if the child's neck is flexed or if the film is taken in expiration. On CT, there is typically thickening of the retropharyngeal space, fat streaking, abscess, and enlarged cervical lymphadenopathy. Herpes simplex virus 20A55, year, old female presents with a right-sided facial weakness, hypercusis, loss of lacrimation and taste. What pathology is most likely to cause this pattern of clinical findings? A facial nerve schwannoma B acoustic neuroma C brain stem glioma D parotid malignancy E malignant otitis media. Abscess and enlarged cervical lymphadenopathy. 20 Answer A. Facial nerve schwannoma. The INTRA temporal segment of the facial nerve is affected in this case. A facial nerve schwannoma is the only lesion that can be limited to this region. Acoustic neuromas can involve CN8, while brain stem gliomas are likely to involve other cranial nerves such as 6. Parotid malignancy and malignant otitis media could compromise the extracranial parotid segment of the facial nerve, but would not be expected to be associated with the loss of lacrimation and taste. 21 Answer malignant otitis media 21A60, year, old lady presented complaining of a hoarse voice and signs of a vocal cord palsy associated with lower cranial nerve palsies affecting cranial nerves 9, X and 11. CT demonstrated a large extra-axial soft tissue mass with calcification and a dural tail entering the jugular foramen. What further imaging features would you expect? A. N plaque spread along the skull base B permeative erosion of jugular foramen C smooth expansion D enhancement with contrast E thickening of the dura. Answer A. N plaque spread along the skull base. It is assumed she has a meningioma. Erosion of the jugular foramen is suggestive of a glomus jugulare tumor, while smooth expansion would be expected in a vagal schwannoma. Enhancement occurs in both neuromas and meningiomas, and therefore is not a distinguishing feature. Thickening of the dura is seen in meningitis or durometastasis, and is an unlikely finding in a jugular foramen meningioma. 22. A young man presents to the ENT department with a painless palpable soft tissue swelling in the right perialveolar region. Contrast-enhanced CT revealed an inhomogeneous contrast-enhancing mass in the mandible. On bony windows the mass was a multilocular cyst with a thin sclerotic margin and a narrow zone of transition. The patient had gingival disease. Which is the most likely diagnosis? A giant cell granuloma. Meningioma. 22. Answer A. Giant cell granuloma. GCG is thought to be a reactive inflammatory process resulting in overgrowth of tissue in response to trauma or infection. They are more common in the mandibular region than the maxillary region and are less than 2 centimeters in size. Patients with GCG typically present early in adult life with a male-to-female ratio of 1:1. GCG is associated with Paget's disease and fibrous dysplasia. Gingivitis is a risk factor. NACOS JS, ETALCT, and MR imaging of giant cell granuloma of the craniofacial bones. AM, Neuroradiol. 2006, 27. D. Lymphoma e nasopharyngeal angiofibroma 23A55, year, old man with known squamous cell carcinoma of the larynx was noted to have some enlarged level 2 nodes on CT, and an USS has been arranged. What feature on USS would make you most suspicious that they were enlarged due to infiltration with metastatic carcinoma? A. Orientated with long axis in axial plane. B. Orientated with long axis orientated along craniocaudal axis. C. Round shape. D. Reduced vascularity on Doppler imaging. E. Prominent fatty hilum 24A. NACOS JS, ETALCT, and MR imaging of giant cell granuloma of the craniofacial bones. AM, Neuroradiol. 2006, 27, 8 1651-3. 23. Answer C. Round shape. Size alone is a relatively poor criterion in defining a neck lymph node to be possibly malignant. Oval nodes with a fatty hilum tend to be benign. The orientation of the node is irrelevant. Further features such as calcification, necrosis, extracapsular spread, and increased Doppler flow could represent malignant spread. 24. Answer 24A16, year, old girl with gradual onset of a swelling below her chin presents to the ENT surgeons. MR revealed a well-defined cystic lesion in the sublingual space with no septations or wall thickening. It was bright on T2, weighted imaging, and low signal on T1, weighted imaging. What is the most likely diagnosis? A ranula B. Second branchial cleft cyst. C. Thyroglossal duct cyst. D. Cystic hygroma. E. Pleomorphic adenoma 25. Answer A. Ranula. These are the classical findings of a ranula. The most important differential diagnosis to exclude is a pleomorphic adenoma, which would enhance on fat-saturated T1 weighted images. B would appear in the posterior triangle, while a thyroglossal duct cyst is likely to be in the midline. D is not normally sublingual and normally multiloculate. 25. A 7-day-old infant presented with poor feeding and increased sweating. On examination he had an enlarged head, prominent forward veins, and a cranial brute. A cranial USS revealed dilated lateral ventricles and increased vascularity posterior to the third ventricle. What is the most likely diagnosis? A sagittal sinus thrombosis B. Vein of Galen malformation C. Giant MCA aneurysm D. Dural fistula E. Sturge-Weber syndrome 26. A 9-year-old girl presented with nystagmus, ataxia, and diplopia to outward gaze. On CT, pleomorphic adenoma, which would enhance on fat-saturated T1 weighted images. B would appear in the posterior triangle, while a thyroglossal duct cyst is likely to be in the midline. D is not normally sublingual and normally multiloculate. 25. Answer B. Vein of Galen, VOG, malformation. VOG malformation is used to describe enlarged deep venous structures of the galenic system fed by abnormal midline AV communications. Presentation is usually early in life with high output cardiac failure and obstructive hydrocephalus. Seizures, focal neurologic deficit, and hemorrhage can occur. Spontaneous thrombosis is known. 26. Answer B. Neurofibromatosis. Neurofibromatosis type. CT. There was a mass within the optic chiasm, which extended into the left optic nerve. The mass had poor patchy enhancement. A further eccentrically enhancing lesion was identified in the left occipital lobe. The most likely underlying condition is a tuberous sclerosis B. Neurofibromatosis type 1 C. Neurofibromatosis type 2 D. Von Hippel-Lindau syndrome E. Sturge-Weber syndrome 27. A middle-aged male had a CT following Type 1. Involvement of the optic tracts is typically seen in NF1. Histologically, most lesions are low-grade astrocytomas, although 20% of chiasmal gliomas may behave aggressively. Imaging is best on MRI, where lesions are usually hypo to isointense on TI and hyperintense on T2 with variable contrast enhancement. 27. Answer D. E. Sturge-Weber syndrome 27. A middle-aged male had a CT following prolonged seizures, which showed a rounded cystic lesion in the cerebellum with an avidly enhancing neural nodule. Other imaging demonstrated bilateral renal cell carcinoma. At what other site is he at risk of developing further cystic lesions? A. Lateral ventricles B. Insular cortex C. Corpus callosum D. Spinal cord E. Pons 28. An 8-year-old spinal cord. The underlying condition is von Hippel-Lindau syndrome, VHL. Differentials for intraaxial cystic lesions in the posterior fossa in adults include metastases, hemangioblastoma, lymphoma, and lipoma. Most hemangioblastomas occur sporadically, while 10 to 20% occur in VHL. In VHL, 75% of hemangioblastomas occur in the cerebellum, and 25% in the spinal cord. Appearances in the spinal cord are those of a syrinx-like cyst with an isointense nodule that enhances strongly after contrast. 28. Eight-year-old girl is admitted following a fall from a horse and complains of neck pain. A CT of the cervical spine demonstrates no evidence of fractures/dislocations. Incidentally, a lucent line is seen across the peg with sclerosis of the margins. The anterior arch appears hypertrophied. With which syndrome is this condition associated? Associated. A Hurler's B. Morchio C. Downs D. Achondroplasia E. Turner's 29. A newborn Chord are those of a syrinx-like cyst with an isointense nodule that enhances strongly after contrast. 28 Answer B. Morchio syndrome. The condition described is os odontoideum, which is either orthotopic with a normal position of the odontoid tip, or dystopic with the tip near the basioccipital bone in the area of the foramen magnum. It may be fixed to the anterior ring of the atlas and the two move as a unit. Subluxation and instability are common. It is often discovered incidentally, and associated syndromes include Morchio syndrome and multiple epiphyseal dysplasia. Differentiation from non-union may be difficult. 29 Answer C. Chiari-2 malformation. E. Turner's 29 A newborn baby was noted to have a thoracolumbar myelomeningocele and upper limb spasticity. An MRI scan revealed a small posterior fossa, low-lying tonsils, an elongated fourth ventricle, tectal beaking and partial agenesis of the corpus callosum. What is the most likely diagnosis? A dandy. 29 Answer C. Chiari-2 malformation. Chiari-2 is the most common and serious complex of anomalies resulting from a small posterior fossa. Chiari-I is not associated with a myelomeningocele and is an isolated hindbrain anomaly without supratentorial abnormalities. Chiari-3 is rare and thought to be unrelated to Chiari-I and II. It is associated with occipital/cervical meningomyelocele. Dandy Walker is characterized by a large posterior fossa, Vermean anomalies, and cystic dilatation of the fourth ventricle. 30 Answer C. Septo-optic dysplasia 30A15, month, old boy was investigated for developmental delay. On clinical examination he was found to have a cleft palate. On CT he had a large posterior fossa, agenesis of the vermis with a large cystic dilatation of the fourth ventricle, and agenesis of the corpus callosum. What is the most likely diagnosis? A Chiari-I malformation B. Schizencephaly C. Dandy Walker malformation D. Septo-optic dysplasia E. Vein of Galen aneurysm 31 an 11-year-old was investigated. Is associated with occipital/cervical meningomyelocele. Dandy Walker is characterized by a large posterior fossa, Vermean anomalies, and cystic dilatation of the fourth ventricle. 30 Answer C. Dandy Walker malformation. Dandy Walker malformations are characterized by a large posterior fossa, Vermean anomalies, and cystic dilatation of the fourth ventricle filling the entire posterior fossa. Midline CNS anomalies are seen in 60%. Differentials include a posterior fossa extraaxial cyst, arachnoid cyst, and a megacisterna magna. Investigated for widespread cutaneous lesions. Magna. Lesions. Imaging revealed ribbon ribs, tibial bowing, and a hypoplastic sphenoidal ala on the left. An MRI of the spine was also performed which showed a mid-thoracic lesion along with some bone remodeling. What is this lesion most likely to be? A ependymoma, B astrocytoma, C neurofibroma, D lipoma, E dermoid, Cis 32, a 32-year-old was imaged following 31. Answer C, neurofibroma. The condition described is NF1. Abnormalities within the spine occur in about 60% of patients. Most of these are secondary to a neurofibroma, which may be dumbbell-shaped along an exiting nerve root. Lateral thoracic meningoceles are also known to occur. Meningiomas and ependymomas are more common in NF2. 32. Answer E, Sturge-Weber. Following sudden onset right hemiplegia. A CT showed subtle atrophy of the left occipital lobe and unusual gyral calcification. MRI demonstrated prominent pial and deep medullary veins in the region with a prominent left choroid plexus. What is the underlying etiology? A tuberous sclerosis, B ataxia telangiectasia, C meningiomatosis, D von Hippel-Lindau syndrome. Sturge-Weber syndrome. Sturge-Weber syndrome is a sporadically occurring phacomatosis in which facial port wine nevi, leptomeningeal venous angiomatosis, and orbital manifestations are described. Presentation is usually with seizures contralateral to the site of facial nevus. The underlying etiology is probably an abnormality in the development of cortical venous drainage. Cortical atrophy, tram tract gyral calcification, enhancing pial angioma, and prominent draining veins may be seen. 33. Answer A. Syndrome E. Sturge-Weber syndrome 33A 12-year-old undergoing chemotherapy for acute myeloid leukemia developed seizures. CT revealed multiple punctate areas of calcification scattered throughout the brain, with little enhancement and no mass effect. Ventricular size was normal. Comparison was made with a CT from 2 years previously which revealed no abnormality. What is the most likely diagnosis? A minralising angiopathy B. Cytornega leveris infection C. Fahrenheit's disease D. Toxoplasmosis E. Carbon monoxide poisoning 34 A. Minralising angiopathy. Minralising angiopathy is widespread perivascular calcification which typically occurs in children receiving both irradiation and chemotherapy for acute leukemia. The commonest sites include basal ganglia and junction of the cortex and subcortical white matter. 34 Answer E. Axial T2 asterisk. E. Carbon monoxide poisoning 34 A 22-year old male presents to his GP with a history of a headache for weeks ago, which he describes as the worst headache of his life. He did not seek medical advice at the time, as he was on holiday. The GP suspects he has had a subarachnoid hemorrhage. Which investigation would best determine if he did have a subarachnoid hemorrhage? A CT cerebral angiogram. B. Lumbar puncture C. Axial stir MRI images D. Coronal flare MRI images E. Axial T2 asterisk. Weighted MRI images 35 A 25-year old fitness instructor presented to the emergency department with a 2-week history of left-sided nystagmus, past pointing and vertigo. Asterisk. Weighted MRI images. The history is typical of a subarachnoid hemorrhage, SAH. A month after the event the blood would have be degraded to hemosiderin, which is low signal on T2, TI, flare and T2 star. Blooming artifact occurs with T2 asterisk, which can help detect small amounts of blood, and would be the most useful test to perform. Lumbar puncture would not be helpful as it is too long since the bleed. Once a diagnosis of a subarachnoid bleed has been made then the cause for the bleed can be diagnosed using CT cranial angiogram. 35 Answer E. Vertigo. CT revealed low-density changes affecting the left superior part of the cerebellum, the left vermis and tectum. What vascular territory is involved? A right vertebral artery B. Left posterior inferior E. Left superior cerebellar artery. Left-sided cerebellar symptoms are caused by ipsilateral lesions in the cerebellum, while left-sided cerebral symptoms are due to contralateral lesions. The most superior aspect of the cerebellar hemisphere, vermis and rectum, is supplied by the superior cerebellar artery. The posterior inferior cerebellar artery supplies the infero-posterior surface of the cerebellar hemisphere. The anterior inferior cerebellar artery supplies the middle cerebellar peduncle, flocculate region, and the anterior petrosal surface of the cerebellum. 36 Answer. E. Left superior cerebellar artery 36. A 5-year-old child was admitted with diarrhea associated with Escherichia coli infection, having stopped feeding at home. She was started on antibiotics but started complaining of a headache and then became drowsy. On CT there was high density within the right transverse sinus. The rest of the brain appeared normal, and there was no hydrocephalus. What is the most likely cause for this? A frontal sinusitis B. Head injury C. Latrogenic D. Dehydration E. Mastoiditis 37. Petrosal surface of the cerebellum. 36 Answer D. Dehydration. This child has a transverse sinus thrombosis. 37 A 64-year-old lady is being consented for a diagnostic cerebral angiogram for a suspected MCA aneurysm. She asks about the risk of stroke. What is the risk due to the angiogram? A 4.7% B 0.2% C 1.3%. 37 Answer C, 1.3%. The risk of stroke due to an angiogram is approximately 1.3%. D 10% E 3.5% 38 A 32-year-old woman had a stormy postnatal period complicated by postpartum hemorrhage, PPH. On the 5th postpartum day she developed nausea and vomiting followed by generalized tonic-clonic seizures. A diagnosis of cerebral venous sinus thrombosis with likely infarction was made. Which of the following is an unlikely feature on the MRI? A empty delta sign B high signal in the 38 answer E, insular ribbon sign. Thrombosis of the deep cerebral veins may cause relatively symmetric infarction of the basal ganglia, thalami, and midbrain. Involvement of the gray-white matter may occur in a non-arterial distribution. MRI demonstrates loss of flow void in the venous sinuses, and depending on the age of the clot a high signal on T2, and flare images in the venous sinuses. Pitfalls include slow flow states and arachnoid granulations. The insular ribbon sign is seen in early arterial infarcts and indicates loss of gray-white differentiation. 39 answer D, right common femoral artery. E insular ribbon sign 39 a 55-year-old man is undergoing a coiling for a right pica aneurysm. Where is likely to be the preferred arterial puncture site? A left radial artery, B left brachial artery, C left common carotid artery, D right common femoral artery. E right common carotid artery. 40 a 55-year-old woman who is hypothyroid. Patients who are undergoing a coiling have a general anesthetic as they need to keep completely still. 40 answer D, diffuse low uptake. This hypothyroid patient has Hashimoto's. E right common carotid artery. 40 a 55-year-old woman who is hypothyroid with a large goiter undergoes a thyroid ultrasound, which demonstrates a diffusely enlarged thyroid with increased vascularity. She then undergoes a technetium 99 and protectatate study. What findings would you expect to see? A homogeneous diffuse increase uptake, B heterogeneous diffuse increase uptake, C diffuse low uptake with a small nodule with increased uptake, D diffuse low uptake, E normal uptake. 40 answer D, diffuse low uptake. This hypothyroid patient has Hashimoto's disease. The ultrasound features of a heterogeneous diffusely enlarged low reflectivity thyroid with increased vascularity are very typical of Hashimoto's disease. On TC, 90. 41 a 45-year-old female fell down a flight of stairs under the influence of alcohol and presented to the emergency department with a deteriorating GCS. A non-contrast CT revealed a 13 mm deep left temporoparietal lenticular hematoma. What is the most likely source of the bleed? A middle meningeal artery, B internal cerebral veins, C bridging cortical veins, D choroidal arteries, E vein of lab 42 a 46. 41 answer A, middle meningeal artery. Extradural hematomas, EV, are biconvex/lentiform in shape and result from a lacerated middle meningeal artery/dural sinus in 70 to 85%. Associated fractures are seen in 85 to 95%. EV occur between the skull and the dura and cross-dural attachments but not sutures. Subdural hematomas are crescentic and are E vein of lab 42 a 46-year-old motorcyclist was involved in a high-speed RTA. On arrival of the paramedics, the GCS was recorded as 4/15, and the patient was intubated at the site of injury. An emergency non-contrast CT showed multiple subtle petechial hemorrhages characteristic of diffuse axonal injury. What is the most likely site of the petechial? Diffuse axonal injury, DI, occurs in severe trauma as a result of shearing stress along the course of the white matter tracts, especially at the gray-white matter junction. The injury is usually microscopic and initial CTS are usually normal despite profound clinical impairment. Acute DI may also be seen as small petechial hemorrhages at the gray-white matter junction, 67%, internal/external capsule, corona radiata, corpus callosum, 21%, and brainstem. Mr. features depend on the age of the hemorrhage. Prognosis is 43 a 22-year-old female rear seat passenger suffered a high-speed road traffic accident and presented to the emergency department with several left temporal facial injuries. Following stabilization of her bony injuries, she was discharged. A week later she developed painful left orbital swelling and third nerve palsy. A post-contrast CT was unremarkable barring some fullness of the left orbital apex and mild enlargement of the left superior ophthalmic vein. A catheter angiogram revealed early opacification of the left superior ophthalmic vein and a vascular blush posteriorly. What is the most likely? 43 answer C, caroticocavernous fistula, CCF. A CCF is a dural AV fistula characterized by abnormal arteriovenous shunting within the cavernous sinus. It can result from blunt/penetrating trauma, although the majority are thought to be spontaneous. Classical presentation is with pulsatile proptoses, chemosis, diplopia, and cranial nerve palsies can also occur. CT and MRI show a markedly enlarged superior ophthalmic vein and prominent cavernous sinus. Congestion of the extraocular muscles may be seen. Angiography is required for confirmation and treatment. Balloon occlusion of the fistula is the treatment of choice. 44 regarding Cryptococcus neoformans in human immunodeficiency virus. Which of the following statements is correct? A Cryptococcus neoformans is the most common fungal infection in AIDS. B. It is found in bird excrement and spreads by direct invasion. C. Results in abscess formation in the basal ganglion. D. Results in a florid meningitic response. E. Results in 44 answer A. Cryptococcus neoformans is the most common fungal infection in AIDS. E. Results in effacement of the perivascular spaces. 45 regarding tuberculosis in the HIV population. Which of the following statements is correct? A tuberculosis Cryptococcus neoformans is the most common fungal CNS infection in AIDS, and is the third most common CNS pathogen. AIDS. It is typically spread hematogenously from a pulmonary source, and most commonly presents as meningitis. On cross-sectional imaging there is thick enhancement of the meninges and ependyma. Communicating hydrocephalus. Hydrocephalus is common due to reduced resorption of CSE. Tuberculomas typically arise in the corticomedullary region, and are supratentorial. They commonly appear as target lesions on both CT and MRI. Ophia CE, Turnbull IW. The hydrocephalus is typically obstructive in nature. 46. A patient with known tuberous sclerosis had a routine follow-up CT. A 3x 2 cm partly calcified heterogeneously enhancing lesion was seen at the level of the foramen of Monro. What is the most likely pathology? A colloid cyst. B. Subependymal giant cell astrocytoma. C. Intraventricular D. meningioma. 46. Answer B. Subependymal giant cell astrocytoma. 15% of patients with tuberous sclerosis develop subependymal astrocytomas. They typically occur at the foramen of Monro, and are usually a well-defined rounded mass with some calcification. They usually enhance uniformly with contrast, and can degrade to a high-grade astrocytoma. 95% of tuberous sclerosis patients have subependymal hemartomas. These occur in the periventricular region, are iso-intense to white matter on TI, and calcified on CT. E. germinoma. 47. A 7-year-old boy presented with sudden onset gait problems, and subtle uncoordination on the finger-nose test. CT demonstrated a low-density cystic solid lesion, with subtle calcification centered on the vermis. Thick heterogeneous enhancement was seen within the solid area along with obstructive hydrocephalus. What is the most likely diagnosis? A pilocytic astrocytoma is the most likely diagnosis, as it is low density on CT with calcification and nodular enhancement. They are commonly located in the vermis, 50%, and are complicated by hydrocephalus. They commonly occur before the age of 9, and are characteristically assist with an enhancing nodule. Hemangioblastoma is a serious consideration, but more commonly occurs in the paravermian position. The nodule is hyperdense on non-contrast CT, and they virtually never calcify. Both lesions can be cystic with a solid enhancing nodule. Hemangioblastomas occur more commonly in adults, and as part of von Hippel-Lindau syndrome. E. brainstem glioma. 48. A 62-year-old female presented to the emergency department with gradual onset weakness in the right upper and lower limbs. CT demonstrated multiple rounded hyperdense lesions with marked vasogenic edema, which showed prominent enhancement following W contrast. Assuming the lesions are metastases, what is the most likely primary? A bladder. B. renal cell carcinoma. C. colon. D. adenocarcinoma. Adenocarcinoma of the lung. E. uterus. 49. A 5-year-old boy was admitted with nausea and increased somnolence. Obstructive hydrocephalus was seen on CT with a posterior fossa tumor. In adults and as part of von Hippel-Lindau syndrome. 48. Answer B. Renal cell carcinoma. Malignant melanoma, choriocarcinoma, oat cell, thyroid and renal cell carcinoma all cause hyperdense cerebrometastases. They all enhance brightly with contrast. 49. A 5-year-old boy was admitted with nausea and increased somnolence. Obstructive hydrocephalus was seen on CT with a posterior fossa tumor. What typical features make medulloblastoma more likely than ependymoma? A. arising form the floor of the fourth ventricle. B. extension through the foramina of Luschka. C. calcification on CT. D. arising from the vermis. E. small cystic area within the mass. 50. A 50-year malignant melanoma, choriocarcinoma, oat cell, thyroid and renal cell carcinoma all cause hyperdense cerebrometastases. They all enhance brightly with contrast. 49. Answer D. Arising from the vermis. 50. Answer A. Dural tail. This woman has a E. small cystic area within the mass. 50. A 50-year-old female was investigated for chronic headaches. ACT demonstrated a well-defined hyperdense parasagittal lesion with calcification that avidly enhanced with contrast. The superior sagittal sinus was invaded and thrombus was present. What other feature on CT would you look for to help clinch the diagnosis? A dural tail. B. bony destruction. C. vasogenic edema. D. ventricular distortion. E. corpus callosal. 50. Answer A. Dural tail. This woman has a parasagittal meningioma. Evidence of a dural tail is very typical of meningiomas, but it can also occur in dura metastasis. 51. A 47-year-old male was investigated for progressive left-sided weakness. On CT of his head there was loss of gray-white matter differentiation with thickening of the cortex, and minor effacement of the sulci affecting the right frontal and temporal lobes. On MRI there was generalized high signal on T2 in this region. On FLAIR there was diffuse enlargement of the right frontal and temporal lobes cortex with vasogenic edema in the surrounding white matter. What is the most likely diagnosis? A oligodendroglioma B gliomatosis cerebri C metastasis D glioblastoma multiforme E heterotopia 52 A25 year old male had an MRI for chronic headaches. On MR there was a cystic mass with an enhancing metastasis. 51 Answer B, gliomatosis cerebri. Gliomatosis cerebri is a grade 3 WHO classification cerebral tumor, which affects at least 2 or more lobes and is principally centered in the cortex, and has little mass effect or architectural distortion. It typically affects patient aged 40 to 50 years of age. On CT imaging it can be easily missed, but features are loss of the gray-white matter differentiation with minor enlargement of the cortex. On MRI imaging bright signal is seen within the affected area and contrast is minimal. Prognosis is poor with 50% 1-year survival. Enhancing nodule in the left sylvian fissure. The mass had an enhancing dural tail and exhibited only minor vasogenic edema. What is the most likely diagnosis? A meningioma B pleomorphic xanthoastrocytoma, C anaplastic astrocytoma D metastasis E lymphoma 53 A43 year old male underwent an MRI to evaluate hearing loss. (52) Answer B, pleomorphic xanthoastrocytoma. Pleomorphic xanthoastrocytoma is a superficial grade 2 tumor and accounts for 1% of all intracranial tumors. It occurs in a younger group of patients with a mean age of 26 years. It preferentially affects the superficial temporal lobe and is cystic with an enhancing nodule and with peritumoral vasogenic edema. 53 Answer A, low signal. Loss. In the right cerebellopontine angle there was a well 53 A43 year old male underwent an MRI to evaluate hearing loss. In the right cerebellopontine angle there was a well-defined mass which was low signal on T1W, high signal on T2W, and low on FLAIR. The signal intensity was similar to CSF, there was scalloping of the bony margins. What would you expect the signal characteristics to be on diffusion-weighted imaging? A low signal. This patient has an arachnoid cyst, which typically has similar signal characteristics to CSF, bright on T2W, low on T1W, and FLAIR. On DWI the signal characteristic is similar to CSF, and hence is low. 54 Answer. A similar signal to the ADC map 54A55 year old chronic alcoholic was admitted following an extended period of heavy drinking. He was noted to be very confused, confabulating, and suffering from delusions. On examination he was ataxic and had ophthalmoplegia. What features on MRI would you look for in order to make the diagnosis? A cerebellar atrophy B high signal perpendicular to the lateral ventricle C high signal within the periaqueductal region D high signal within the vermis E high signal with 54 Answer C, high signal within the periaqueductal region. Chronic alcohol results in atrophy of the cerebellum, particularly the vermis. This patient has Wernicke's encephalopathy, which is characterized by confabulation, delusions, ataxia, ophthalmoplegia, and confusion, and is caused by thiamine deficiency. High signal is seen in the periaqueductal region, paraventricular thalamic regions, and mammillothalamic tract on MR imaging on FLAIR and T2W. E high signal within the lentiform nucleus 55, a 35-year-old presence with progressive personality changes and increasing withdrawal. CT brain demonstrated cerebral atrophy affecting the frontal lobes and anterior temporal lobe with associated compensatory enlargement of the frontal horns of the lateral ventricles. The rest of the brain was normal. What is the likely diagnosis? A Alzheimer's disease B Parkinson's disease C progressive supranuclear palsy D Fabry's disease E Pick's disease 56. On FLAIR and T2W. 55 Answer E, Pick's disease. Striking disproportional atrophy of the frontal and anterior temporal lobes in a young patient is typical of Pick's disease, which is also known as frontotemporal atrophy. In Alzheimer's disease there is medial temporal lobe atrophy with compensatory enlargement of the temporal horns. Parkinson's disease results in a generalized cerebral atrophy. Progressive supranuclear palsy results in atrophy of the midbrain, globus pallidus, and frontal lobes. 56. Pick's disease 56. A 39-year-old man was being investigated for progressive involuntary movement. On CT, he was found to have caudate atrophy with compensatory enlargement of the anterior horns of the lateral ventricles. What would one expect to see on MRI imaging? A eye of the tiger sign. B. High signal in the caudate and putamen on T2. Weighted Mr. Images. C. High signal in the thalamus. Thalamus on T2. Weighted Mr. Images. D. Loss of the pars compacta. E. High signal in the pons on T2. T2. Weighted Mr. Images. E. High signal in the pons on T2. Weighted Mr. Images. 57. A 63-year-old male undergoing a CT for unwitnessed fall had marked widening of the cerebellar sulcal spaces suggestive of cerebellar atrophy. Which of the following is unlikely to be a cause? Answer B. High signal in the caudate and putamen on T2. Weighted Mr. Images. This patient has Huntington's chorea, which has autosomal dominant inheritance and is characterized by involuntary chorioathetoid movements and severe memory impairment. The age at which symptoms occur is dependent on the length of the trinucleotide CAG repeat mutation on chromosome 4, but is typically around 40 years. On imaging, there is bilateral atrophy of the caudate lobe with compensatory enlargement of the frontal horns of the lateral ventricles. High signal is seen within the caudate and putamen in the juvenile form. 57. Answer D. Tuberous sclerosis. Phenytoin, alcohol, ataxic telangiectasia, and paraneoplastic syndrome from a bronchial tumor all result in cerebellar atrophy. Other causes are marijuana, steroids, radiation, multisystem atrophy, and gluten insensitivity. 58. Answer C. A 17-year-old boy was being investigated for partial complex seizures refractory to drug treatment and was being considered for a lobectomy. An interictal FDG PET scan demonstrated reduced signal in the right temporal lobe. What would be the next appropriate step in management? A. Continue with medical management. B. Perform an ictal FDG PET scan. C. Right temporal lobe resection. D. Left temporal lobe resection. E. Radiotherapy. 59. C. Right temporal lobe resection. This patient has temporal lobe epilepsy caused by mesial temporal sclerosis. On MRI, there is atrophy of the hippocampus, amygdala, mammillary bodies, and fornix. High signal within the hippocampus is seen on T2, weighted imaging, which may be bilateral in 20% of cases. Nuclear medicine imaging can be used to diagnose the site of the epilepsy focus. On interictal FDG PET imaging there is decreased uptake of radiotracer at the site of fit focus. On ictal SPECT scanning there is increased uptake of tracer at the focus of the fit. If epilepsy is refractory to antiepileptics, a temporal lobectomy can be performed. Approximately 50% of all temporal lobe resections are for epilepsy. Radiotherapy 59A45, year, old male patient attempted suicide by taking all of his prescription tablets. 18 hours later he was found unconscious at home. He was stabilized and a CT head was performed the next morning. He is found to have wedge-like low densities affecting the occipitoparietal and midfrontal regions. What tablets is he most likely to have taken? A. Antiepileptics. B. Antihypertensive. 59. Answer B. Antihypertensives. This patient has infarcts in the regions of the watershed areas between the anterior and middle cerebral arteries and the middle and posterior cerebral arteries. This patient must have taken something to reduce the cerebral perfusion. Antihypertensive medication. 60. You are teaching an F1 about interpreting the difference between vasogenic and cytotoxic edema. Which is a feature of cytotoxic edema? A sharply demarcated border B demonstrates restricted diffusion on DWI. C. Edema involving the cortex. D. Edema extending across the corpus callosum. E. Associated with ischemia. 61. On plain. This patient has infarcts in the regions of the watershed areas between the anterior and middle cerebral arteries and the middle and posterior cerebral arteries. This patient must have taken something to reduce the cerebral perfusion. Antihypertensive medication is the best answer. 60. Answer D. Edema extending across the corpus callosum. Vasogenic edema is edema associated with either a primary or secondary tumor. It is caused by increased vascular permeability. On imaging there is edema within the white matter not affecting the cortex. It can extend across vascular territories and the corpus callosum. Cytotoxic edema is caused by ischemia and results in arrested metabolism of cells. It appears as edema conforming to a vascular territory with well-demarcated edges and involves the cortex. It does not cross the corpus callosum. There is restricted diffusion on DWI. (61) On plain film X-ray of the lumbar spine, a dense single vertebra is seen, ivory vertebra. The vertebra is not expanded and the trabeculae are not thickened. There is no evidence of disc space narrowing, periosteal. 61. Answer D. Lymphoma. The term ivory vertebra describes single or multiple very dense vertebrae, and all the options listed are causes. Paget's disease and hemangiomas show coarse reticulation and some expansion. Low-grade infections are associated with end plate destruction, disc narrowing, and paraspinal masses. Sclerotic metastases generally do not show expansion, but a history of underlying malignancy is often available. Hemangioma. 62. A 4-year-old child had a skeletal survey, which revealed central beaking of the vertebral body. What is the most likely diagnosis? A Hurler syndrome. B. 62. Answer B. Morquio syndrome. Anterior vertebral body beaks are seen at the thoracolumbar junction and usually associated with kyphosis. All the options listed are associated with anterior beaks, but most occur in the lower third of the vertebral body, except Morquio syndrome, where this is seen more centrally. Other manifestations include hypoplastic dens, dorsal scoliosis, irregular ossification of the femoral capital epiphyses, and short, wide tubular bones with irregular metaphyses. 63. Answer 63. A 22-year-old gymnast was admitted with signs of right L4 radiculopathy. An MR was performed which revealed disc pathology. What is the most likely site? Answer E. Right L4/L5 lateral disc bulge. Intervertebral disc herniation and degeneration is the most common source of compressive radiculopathy. The lumbar roots emerge from below their respective vertebrae. Different nerves are compressed. 64. An 86-year-old woman complains of chronic neck pain. She has had multiple admissions for fractures and is on a bisphosphonate. A skull X-ray is taken. On the lateral film the odontoid peg is seen at the level of McGregor's line. What is this condition? 64. Answer C. Basilar invagination. McGregor's line extends from the posterior limits of the hard palate to the base of the occipital region. The odontoid peg should lie 5 mm below this level. If it is at the level of the McGregor's line, this is basilar invagination. Causes of has-had invagination are rickets, osteomalacia, fibrous dysplasia and developmental such as Klippelfehl. Platybasia is flattening of the skull base, and it commonly occurs with basilar invagination. The basal angle is greater than 140 degrees in platybasia. 65. Breast cancer and was on tamoxifen. She underwent an MRI scan for further assessment. What feature makes an osteoporotic fracture more likely than metastatic disease? Answer C. Normal pedicles. Features that are suggestive of a bony metastasis are a bowed posterior border of the vertebral body, abnormal signal in the pedicles, an epidural or paraspinal mass, and multiple lesions. Features suggestive of osteoporotic wedge fractures are low signal on both TI and T2, weighted imaging, spared normal marrow signal, and multiple. 66. A 39-year-old male who was being investigated for neck pain was noted on CT to have posterior vertebral scalloping of the C4-7 vertebra. On MRI, the cord was expanded at this level by a well-defined tumor, which was high signal on T2 and low on T1. There was intense homogeneous enhancement with contrast. What is the most likely? Ependymomas are the most common primary spinal cord tumor. They most commonly occur in the cervical region followed by the thoracic region, and extend over a large area, average of 4 vertebral bodies. They are well-defined and central lesions. They often have a low signal rim around the outside due to hemosiderin from repeated bleeds. As they are slow-growing tumors, they are associated with bone remodeling. They metastasize to the lung, retroperitoneum, and lymph nodes. There is an 80% 5-year survival. 67. A 60-year-old woman was admitted with immobility and was found to have a raised ESR. The remainder of her blood tests were normal. On T1, weighted MR, there was some nodularity along the nerve roots with nodular contrast enhancement along the cauda equina. What is the most likely diagnosis? A drop metastasis from ependymoma. B. Metastatic breast cancer. C. Survival. 67. Answer B. Metastatic breast cancer. Drop metastases are most commonly seen in the pediatric population and are most commonly due to PNETs, medulloblastomas, ependymoma, germinomas, and pinealoblastomas. In adults, metastatic breast and melanoma are common causes. The above description is very typical. Irregularity along the surface can also be seen. 68. Answer E. 68. A 46-year-old male complained of lower back pain and fecal incompetence. On plain film, there was a large expansile lyric destructive mass in the sacrum with moderate internal calcification. It was heterogeneous and of low signal on TI and high on T2. The mass enhanced with contrast. The patient had no other medical history. What is the most likely E. Chaudoma. This is a typical description of a sacral chaudoma. Chaudomas originate from embryonic remnants of the notochord. They arise in patients. 69. A 55-year-old female with progressive lower limb weakness. Patients aged between 30 and 70 years of age and are more common in males. The most commonly occur in the sacrum than the clivus. They metastasize to the liver, lung, and lymph nodes and tend to recur despite radical surgery. 69. Answer C. Weakness was being investigated by a neurologist. On spinal MR, there was a well-defined 1 cm intramedullary spinal mass at D6 level, which was high signal on both TI and T2. A low signal rim was present on T2, weighted imaging. On T2*, there was blooming. No high signal was seen in the cord. What is the most likely diagnosis? A. Ependymoma. B. Pilocytic astrocytoma. C. Spinal cord cavernous angioma. D. A. C. Spinal cord cavernous angioma. Spinal cavernomas are uncommon, unlike cerebral cavernomas. They typically present in women. Women, M. F equals 1:4, between 30 and 50 years of age, and are most common in the cervical and thoracic regions. They are intramedullary lesions, which are well-defined and are bright on both TI and T2 as they contain methemoglobin. Blooming artifact is present because of the presence of hemosiderin from previous bleeds. Little mass effect is seen. A common presentation of spinal cavernomas is with Brown-Séquard syndrome, hemiparaplegia, ipsilateral loss of proprioceptive sensation, hyperesthesia, and contralateral loss of pain and temperature. Progression of symptoms is common. 70. Answer D. Wormian bones. Metastasis. 70. A 6-month-old baby underwent a chest X-ray for a persistent cough and was found to have absent clavicles and supernumerary ribs. On pelvic X-ray, there was a widened symphysis pubis. What feature would you expect to see on the plain skull X-ray? This patient has cleidocranial dysostosis, an autosomal dominant condition which results in delayed ossification of midline structures. Patients typically have absent or hypoplastic lateral clavicles, supernumerary ribs, hemivertebrae, widened symphysis pubis, absent or short radius and elongated second metatarsals. In the skull, patients typically have Wormian bones, widened anterior fontanelles, large mandible, and small paranasal sinuses.